Can grandparents provide health insurance for grandchildren? Have you ever wondered if grandparents can step in to provide health insurance for their grandchildren? This question is especially important during times of family transitions. Let's break it down. Grandparents can indeed provide health insurance for their grandchildren, but it depends on several factors. First, legal guardianship plays a role. Generally, a grandparent does not need to be a legal guardian to apply for health insurance on behalf of a grandchild. However, some states may consider the grandparent's income when determining eligibility for programs like Medicaid or the Children's Health Insurance Program. If a grandchild is uninsured, grandparents should check if their employer's health insurance plan allows them to add grandchildren as dependents. This can vary significantly by employer and the specific insurance policy. For those with federal employee health benefits, there are specific conditions. A grandchild can be covered if they are under the age of 26, live with the grandparent, and the grandparent is the primary financial supporter. The grandparent must also expect to raise the child to adulthood. Certification of these facts is required to add the grandchild to the insurance plan. In group health insurance policies, grandparents may add a grandchild if they have legal guardianship and the child resides with them. If grandparents claim a grandchild as a dependent on their federal income tax return, they become responsible for ensuring the child has health insurance coverage. Under the Affordable Care Act, most Americans must have health insurance or face a penalty, which applies to grandchildren claimed as dependents by grandparents. Many grandparents who take on the role of raising grandchildren often seek health insurance to ensure their grandchildren have access to necessary medical care. It is essential for grandparents to explore all available options. This includes employer-based insurance, Medicaid, the Children's Health Insurance Program, and plans available through the Affordable Care Act marketplace. Grandparents should also be aware of state-specific rules regarding income considerations and legal guardianship, as these can affect eligibility and enrollment. Securing health coverage is a vital part of the broader responsibilities that grandparents take on during life transitions. They often provide stability and support when parents are unable to do so. In summary, grandparents can provide health insurance for their grandchildren through various means, especially when they are the primary caregivers or legal guardians. They should carefully review eligibility requirements for different programs and insurance plans. Taking responsibility for obtaining coverage is a key aspect of family relationships during transitions where grandparents assume caregiving roles.